Hi everyone, good morning. I'm Dr. Rez from Islands Pediatric Dentistry in Gilbert, and we have Sam, who's 4, and Tara, who are back after 3 weeks of for post-operative visit after 3 weeks of lip tie and tongue tie release. Now, a young man had a very extremely tight, wide attachment that connected his lip to the gum line very tightly, so it wouldn't allow him to have the freedom of motion under the lip. And same thing under his tongue, that made it difficult for him to breathe at night. He was doing some grinding and sleep apnea symptoms simply because if the tongue cannot elevate to the roof of the mouth when you're sleeping, it very often falls in the back of your throat. So what we've done for him 3 weeks ago, we used our laser and we colorized the tissue. So you're back and he's healed wonderfully. You've done an amazing job with the massaging of the wound. I'm very interested to hear as far as how his pain level was after the surgery. And one of the number one questions we get is that.
We kept him on Tylenol and Advil, but his pain was very manageable. He didn't have very much. I kept it on the first day, but he really didn't need it. We let him decide if he.
Really? You're a super kid, huh? Give me a high five, baby. You did amazing. So 1 day is actually usually we do for 2 days,
yeah.
But sometimes again we get kiddos who don't even need it past 1 day, and sometimes we get them for an additional day or 2. But I'm so happy that your pain level was so low. And how did he tolerate it when you went to rub the wound for the wound management to prevent it from reattaching? Because you know, as we discussed, that's really the most important part after the surgery to make sure we get optimal healing. And you've done great.
Oh, thank you. He did. The first day was hard because it was still healing,
Mm-hmm.
but after that he did great. We did give him the choice of which one do you want to do first, the top or the bottom, and so kind of gave him a sense of I'm doing it myself.
Which one was your favorite, the top or the bottom? The bottom was your favorite.
I'm doing the bottom.
Usually the bottom was a little more difficult under the tongue, but he's such a cutie too. So I'm very happy because he's healed so well. As the new permanent teeth come in around age 6 or 7, we're going to see that the large gap that was caused because of that attachment, I expect that to close significantly. So aesthetics are going to improve. And then what we're going to work with him is to how to park his tongue on the roof of his mouth. So that way when he goes to sleep, then the sleep apnea, which is huge, is going to minimize. And I love your shirt, and thank you for being on the movie, on our clip. Do you want to say anything to the kids out there? Do you want to wave at anybody? Well, we wish you guys all have a fantastic day, okay? If you have any lip tie or tongue tie issues, which a lot of times shows up as difficulty nursing on your babies or on the kiddos Sam's age, speech issues, very often these kiddos can't pronounce their W's and their Z's. So instead of Robert, very often they say Robert. So if you notice any speech issues or sleep apnea, because again, if the tongue cannot go out all the way, or up all the way to the roof of the mouth, when you're sleeping, very often falls in the back of the throat. So the number one issue is that. So if any issues with that, we can here to help you with the answer. Okay? Love you all. Have a great day.
Thank you.